Okay, let's talk about our patient today.
Our patient today is a dentist.
Young lady, a preeminent lecturer,
A dental hygienist.
from Bulgaria,
Buffalo, New York.
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers.
10 Lumineers,
6 Lumineers.
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
And now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that.
Before we begin, one of the important parts of this is that what goes on backstage. Behind the scenes preparation is critical when you start doing Lumineers for your patients. So we're going to take a minute and just talk about preparation before we start. And I'm going to simplify the whole process for you. Everything we're going to do is fit the rule of 55. Now the rule of 55 is quite simple. It stands for 5 steps and 5 surfaces. The 5 steps are surface preparation, bonding to that surface, finishing the tooth, and then adjusting the occlusion, and the last thing, step back from the patient and look at their full view. The other part of the rule of 55 is there's 5 surfaces: porcelain, enamel, composite, metal, and dentin. You can bond to all 5 of those surfaces by using particular sequences of solutions. And that's what I want to impress upon you today, because when you first look at this, you say, how could I ever do it? And as long as you keep that rule of 55 in your mind and what stage you're in, it's simple. Now, one of the reasons it's simple is Pam has laid this out. And you don't always have to lay it out, but I suggest when you do your first case, you have somebody in for the afternoon, and you take your time and you go through each step. Now the first step that you want to do is treat the luminaire. What are luminaires? They're thin pieces of porcelain that are so strong they can be made as thin as a contact lens, but remember, they can be made as thick as you want them to be, 2 or 3 millimeters if you choose. One of the critical parts of this is magnification. I'm going to be using 4-power magnification. And at some time during this presentation, we will be showing you the Lumineer magnifying system. It's 4-power, it's ultra lightweight, and I can just flip it up and down. So if you have 4-power magnification, that enables you to get within about 3 to 4 inches of the tooth optically, and be about this far from the patient physically. So magnification is a critical part of this. Materials are a critical part. Recently, we've been analyzing cases where dentists have been having failures. More often than not, about 80% of the failures come back. The dentists have not been using the Ultrabond, the Tenure, and the other materials that I'm demonstrating today. We still get a few failures, sometime in technique or out of modifying occlusion or something, but we don't have the failure rate with the materials we're using here today, and that's why I use them. I'd like to take a moment and just show you some pictures of some of the different kits that we're going to be using and what they enable you to do for your patient. Now this is the try-in paste. And with this, it's resin-based. It's the same material that Ultrabond is made out of, and allows you to look at the shade of the tooth. When you put a luminaire on the tooth and there's an air space between the porcelain and the tooth structure, you get an opaque white appearance that isn't appearing to be what it's like after you bond it. So we'll be using the try-in paste. With the Ultra Bond Multi-Shade Kit, you can vary this from shade B1. I think we've got another shade that's just coming out called B1, A1, and then a Supreme White. That's a picture of what's inside. And then I'll be using the Shade Modification Kit. This is for the patient that has one tooth that doesn't match, or you want to change the shade of the whole group of teeth. And with this, with minimal thickness, you can have natural opacity, and you can revitalize porcelain fused to metal crowns with this kit, the Revitalize Kit. And that enables you to put luminaires over crowns and bridges. You all have patients in your practice, I know you do because I do in mine, where the bridges are still sound. You placed them many years ago. And the problem is quite simply this. You tell the patient, I can make a new one for you, and the proverbial answer is, no thanks. They just forget about it. But now when you tell them you can make it look like new, and there's no shots, and there's no drilling, and there's no unpleasant experience with it, you'll find there's a great number of people who would appreciate having that service. At the end, one of the things that's very important is the finishing kit. And in that finishing kit, that enables you to open the interproximal embrasures, to get rid of the speed bumps that some people get when they don't use Cerinate porcelain, and you're able to adjust the occlusion and refine everything. So it's open your contacts. So it's all in the finishing kit. And the other thing, I'd like to have the tenure. I'd like to show them. This is tenure AB. And you don't need to light cure this. You just place this on the tooth, put 3 or 4 coats on. You'll watch me doing this on the natural teeth. And then when we're taking the try-in paste out of the porcelain, out of the Luminaire porcelain veneer, we'll be using Tenure S. And Tenure S is an activated resin that takes out the resin, most of the try-in resin, and what's left behind will become actively polymerized with the entire tooth. So with that, I think we should begin, and what I would like you to do is just show the audience how you treat one porcelain luminaire with the Silane, the porcelain conditioner, and then they put on the, so we can show it to them. And so Pam is now putting porcelain conditioner on the porcelain veneer. All of this is on your video DVDs that you have. And put that on for 10 seconds. It's porcelain conditioner. And then wash it off. The porcelain conditioner is citric acid. It's an organic acid. Organic acid is critical. Then the next step is to apply the Silane. And the Silanes are the most active and the strongest when they're just activated at the time of application. So when you have a says Cerinate Prime right here, you'll see that again. And we also use this on revitalizing bridges. When you want to put a porcelain veneer over a porcelain crown and you don't have to remove the crown. And then Pam puts that under the foil to protect it from the light, and it's all set. Now we used to put Tenure S on first or visor seal, but with the try-in paste we don't do that. So this is our patient. She's a very attractive lady who has, and what I want to point out to you is she has very attractive teeth. What most of you would tell your patients is, well, your teeth look beautiful and you don't need anything. So one of the 3 favorite phrases, let's have a big smile. Oh, aren't those teeth gorgeous? And so you're thinking, well, she doesn't need anything, and that's what I think too. But she wants something. And believe it or not, in addition to reshaping and the things that we think about and realignment, patients want permanent whitening. Whitening is incredible. I keep thinking whitening is routine now, like brushing your teeth. But they found that in some of the pickups where the news are interested, and you find there's going to be a lot of newscasts interested in this in England, about changing your appearance without having to cut your teeth down. You see, for 4,600 years, we dentists, since the days of Hesse Ray, have been practicing dentistry by cutting away. And what we cut away was painful. It was an unpleasant process. So you have a big obstacle to overcome. We have a reputation. Right now, people know that you're a nice person and I'm a nice person, but they don't like what we do to them. And so unless you make it clear to your patients that this is the most significant advance in 4,600 years of dentistry, they'll think you're just another dentist talking about a painless technique and a pretty smile. And down deep in their heart, even if you don't hurt them when you give them a shot, they still don't like it. And so this is a process that is painless, it's permanent, it's pleasant. We see other manufacturers all of a sudden saying, we can make a thin veneer. But then they talk about speed bumps because they're afraid that if they start trimming the veneer, it's going to break. And you'll see us after we place it, we'll trim the margins. I can do all this because I'm working with 4-power magnification. And that's very critical to have this. 4-power magnification this is the LUMINEER magnifying system. And this is the magnifying system that I was telling you about. So on this glass, you want to go to your optometrist or ophthalmologist and have a single vision lens with a correction in it to allow you to see about 1 meter from, or 2 meters, between 1.5 meters from your face, so you can see across the room and up close. You don't want bifocals if you're at that age where you require them. And so then you can flip it up, look across the room, or when you've got the patient in the chair, you can now look at this, and that's what I'll be doing, is working with magnification. You have total control. So you don't have to rely on tactile sense for drilling on enamel or dentin. This is really critical. All these things I'm showing you today, in my opinion, are very, very critical. If we take a look over here on the side, you see, now she has a bridge that has been placed there many, many years ago. And until now, we didn't have very many options of what we could do for these patients. She also has a crown on the lower right. You can see the metal margin. With the Revitalize Kit, you have the ability to make these look like they've just been placed and not show any of that. And you can see she has bridge work back there. I think we're only going to go back to about the first bicuspid. One of the things that I'd like to stress is that more often than not, I do either 4 or 8 lumineers, sometimes 10. And the reason is that when you do 6, and once in a while I do 6 and it works out, it makes it appear as though the 6 front teeth are out in front of the back teeth and they have more of a dark vestibule to be in. And so when you do that first bicuspid, it just rounds it out. Now remember, one of the things that we're doing is till now, you and I have been treating teeth, and now we're not treating teeth anymore. We're treating smiles. And so we don't go in for 1 or 2 teeth. If you want to have a failing case, a dentist tried to do all the teeth except the right central. And the reason she didn't do the right central is it had a porcelain crown on it, and she didn't know she could bond to it. So needless to say, it never matched, nothing looked good, and it failed. Eventually what she did, she gave up, and she ground all the teeth down and then did a traditional veneer system, including the one on that other tooth, and put the patient through unnecessary trauma. So what we're really talking about is people will have more of this accomplished if they can get it as easily as they can get a set of fingernails placed. And that's about how much trauma it is to the patient. So with that thought in mind, I guess we should begin. Before you start, what I like to use instead of pumice, you can use pumice, but I like to use the porcelain laminate polishing paste because it gives a very smooth surface and gets rid of all the plaque better than pumice does. And you will see us using this again when we're finishing the porcelain. Now the teeth, we're ready for surface preparation on the teeth. Now the important thing to remember is it needs to be clean and dry for short periods of time. And so now we're going to put on Etch and Seal. I like to put it on the tooth just a little dab like this. And Etch and Seal is phosphoric acid. It's 18%. with aluminum oxide, and the purpose of that is to seal the dental tubules. Then after I place this on the tooth, we just put this around in this fashion. There's many ways you can apply the etching agent. And we're applying tenure AB now, so I can have these two. And Pam has just put them into the Dappen dish, so we have a single solution. And I'll just apply several coats of this. And then after we put this on, we'll try some of the lumineers on to see how they, quote, fit. But with tenure AB, it is not light dependent. So it works with all composites, and I hear about 6th generation and 7th generation. I think that's all nonsense. What you want to talk about is a system that just keeps working. And if you have this, you've got one application. They say we have one where you don't have to etch, and so we also have tenure Unibond when you're putting it on dentin. But this is primarily enamel, and many people say, well, do you really need it? Well, I don't know what you need. I just know it's a belt and suspenders. And as you can see, it doesn't take very long to apply. And I put several coats of this on. And then the next step we'll do is try on one or two of the lumineers. Now I want to put one on that doesn't have any try-in paste on it first, and then I want to compare it to one that does, so they can see the visual difference in the appearance. One of the reasons I don't like to do a lot of try-in with patients is there's a tendency to look at it like if you were looking at a suit with your tailor. And so you're looking at parts that you don't like. Now, this is the patient's right central without try-in paste, and then if we could have the... can you give me the left central with try-in paste? Okay. And I don't know if you can tell the difference, but this is much more opaque white than this right lateral. I'll just turn it a little bit. And you can see that this doesn't look very good. Now we'll put the try-in paste on, because you see, we don't rely upon marginal fit with lumineers the way we rely on marginal fit with a gold crown or with a porcelain crown where you have margins and then you seal it. This right central looks much more natural than it did when you didn't have the try-in paste. But whatever you do, you can't put anything over the tenure AB or the Silane. One of the things you have to be very careful with your staff is they don't get the teeth mixed up, because that spoils your day. And all of a sudden now the patient begins to look a little different. And we take the brush and wipe most of this off. That's all there is to that. So sometimes I give the patient a mirror and sometimes I don't. When they want to look at it ahead of time, they just should look at it for maybe a general appearance of the shade. Right away you can see we've lightened these teeth, and you can tell there's going to be a difference. And I'm always amazed, because my reaction always is, especially in this patient, she doesn't need anything. But people don't need lipstick to wear that. They can be beautiful and they put lipstick on and they look more beautiful. So now that we've done the try-in, we're going to remove the resin with tenure S. I'll take it off the tooth and Pam will take it off of the laminate, and then we'll start with the active. And the nice thing about this try-in paste, it holds the lumineer in place while you're looking at it. I'm going to use tenure S, and it's these little scubies that are square sponges, square cubes, and then they're going to clean out the try-in paste. Now we're putting tenure S everywhere before we put the Ultrabond on, and that protects the surface. But whatever you do, don't put the tenure S on before you put on the try-in paste, otherwise it'll polymerize. Yeah. And this is the Ultra Bond Plus. And so we'll take that, and that's where we're going to use shade B1. There you go. I used to not do try-ins. And I wouldn't do try-ins if I didn't have the try-in paste where everything blends together. Now by putting these all on together, I don't have any separation caused by either a matrix strip or a celluloid strip. And I frequently get questions, why do I do it all at once? Because it seems simpler if you would do these two at a time or one at a time. And I've done it probably all kinds of different ways. But sometimes when I do two teeth and then I go to the next two teeth, I get excess on the adjacent teeth. And then I'm going to put this in. Now we have 10-year S again, and it's in the dappen dish, and I just use this to wipe off the excess everywhere. And so I have just found this is so simple, and if you have a Sapphire Light, you'll watch me polymerize these in just a matter of less than a minute. Now I'm going to take the Sapphire Light with the 2mm tip, and I'm going to apply this to the teeth for 1 second. And I tell everybody to close your eyes. And what this does, it tacks the veneer in place. And I don't like the technique of waving a wand of light over everything, because then what you get is partial polymerization. And then when you go back to get the final, you'll never receive the same degree of polymerization that you get if you did it all at once. This 1 second is right in the middle, keeps the laminate from falling off, and then allows us to go in, okay, and wipe off the excess on the interproximal. And I'm not worried about these anymore moving around. And even though I don't sound like it, I worry a lot, because placement is very much like flying an airplane. Flying an airplane is a very, very simple thing to do if we have any pilots in the audience. And then I want to remove as much as I can on the lingual, so that the less composite I have, Ultrabond. Okay, now we're going to the final polymerization, and then we'll let the patient have some water and speak or something. We're going to do, you can't see this yet, but I just put this in place, hold it with my finger, and I say close your eyes, and we give 5 seconds. And we go to the next tooth and just keep repeating the process. And that's 5 seconds. One of the reasons why veneers pop off is because they don't get bonded well, or they don't get cured enough. Close your eyes. Closing your eyes is the best protection for your eyes. Now, I don't know if anybody was using a stopwatch, but we just did 6 veneers in less than a minute. Close your eyes. Now we'll go on the lingual side. This is a critical stage, surface preparation and making sure that you don't fool around with these too much in premature finishing, because that's when you get the voids, is when you move the laminate and place it and squeeze it and place it and squeeze it, and pretty soon you're looking and you got voids in there. And you can always tell when you got voids because patients that drink red wine get it underneath your laminate. I can't say I've ever had it not happen to me, but I remember when it did about 15 years ago, and I was very careful after that not to Now my eyes are closed, even though you can see that. We're all done with the polymerization stage. If the patient would like to rinse her mouth for a minute, she can do that. But it took us less than 15 minutes to place those, try them in, and now we're going to finish them. When you got this package, you got everything I'm using, so you don't have to worry about it. So if you're looking for a tool, it's there. So now these are special diamonds that and fluted burrs that I found simplify the process for finishing and adjusting occlusion and recontouring these. One of the points I'd like to make before we start is if you look at the patient in this area, we've closed the interproximal embrasures. And sometimes it doesn't look that good as it is when you open them up a little bit. Sometimes you want to close them where we are. So we're able now to place feather-edged margins, and that will mimic the dental enamel junction right up here. So the first thing I'm going to use is a fluted burr, if I could have that. It's in the LUMINEER Finishing Kit. And the reason I want a fluted burr is I'm going to take off the excess Ultrabond resin. And it won't scratch the porcelain, and I always stay around the edges. Now you can probably see, well, you can't see very much yet, but you'll get to be able to pretty soon, is we're just taking off the polymerized Ultrabond, and I'm going around the margin. You'll be able to see that in a minute. And the critical part of this is to remove the composite. And if I were using a diamond, it would be very easy to ditch the porcelain. Now there are easier finishing techniques, but I think they compromise the ultimate bond strength. I often get questions about whether or not I could use matrix strips and all that, and you can if you want to. I just don't, because I get perfect contacts otherwise. I have not found it necessary, and my patients have never felt any pain to use anesthetic to do these in the last 20 years. And I just tell my patients, if I'm drilling on something that hurts, I'm drilling on the wrong tissue. So you tell me, and I'll stop drilling there, and that's where my limitation comes in with aesthetics, because we can wax these and modify these to compromise and give a very aesthetic look without the requirement to remove painful tooth structure. I'm just going around now, trimming the excess, and you'll notice that we stay away from the center of the tooth, because when you trim these margins, there's no direct reflection back in the smile. And we want to open these embrasures. And the more you clean off on the back side, the easier it is. You see there's very little back there. And you don't have to get it all off on the first visit. So what I like to do in the first visit is just remove enough to make the patient look better, open some of the contacts. And now we're going to use the Shure 349 instrument. This too is in the finishing kit. It looks pretty ominous. It happens to be an orthodontic band seating instrument. And the thing that's neat about this, you never want to use your hygienist scaling instruments, because a scaling instrument would scratch the heck out of this. So we just use this and start popping off the Ultrabond. And it won't scratch the labial surface, but remember it has to be a Shure 349. And you don't want to have an instrument that can scratch it. And if you don't get it all off on this visit, you just tell the patient that they'll have a little bit of flaking for a day or two, and then I always like the patient to come back in a week or so. And I don't like to use burrs on the enamel and the porcelain and the backside. I like to use fine diamonds. And when I do tooth contouring, I like to use ultrafine diamonds, and that's why the patients don't have to have anesthetic. We're not in a hurry. We shave it off with a light feather touch and a water spray, and I use finishing diamonds for doing my tooth modification. You'll get a chance to see this, but What we really have now is a very solid mass, homogeneous mass of LUMINEER porcelain, Ultrabond, and tooth structure. And I make them all blend. I just pretend like I'm carving a tooth, putting in the anatomy and the finish that we want to get. If you ever find you have an open margin where you didn't get enough resin, we can always put some Ultrabond back. And by using this American football-shaped diamond, I'm blending the porcelain with the tooth, and then we'll open the interproximal embrasures. And on this patient, I didn't have to remove any tooth structure. You see, there, you could, and there's nothing wrong with it if you like to remove it, but I try to remove as little as possible. What I'm doing right now is opening these interproximal embrasures, and by getting most of the resin out of the interproximal embrasure, when we open the contact, it'll be much simpler. And so with see, if I didn't have magnification, this wouldn't be near the ease that it is to do this process. And I'm opening these embrasures a little bit more in the labial. Now I'm using this interproximal diamond that's in the kit. Light feather touch. You know, one of the problems that a lot of dentists have is they like to take these really hard cases and make that their first case. I like to take my first cases to be the very simple ones. So all of a sudden you see what's happening here. And we'll take the saw. Okay, this is a Cerisaw. Looks like a hacksaw. So I just start slicing in like that, and then you rock it back and forth, and there's less chance of slipping through and cutting the interdental papilla. And so I'm using the most pressure that I've used, and it's the part where I tell patients, I say, it's hard for you to imagine that I'm really doing final finishing and really making this thing look good, and I'm using all this pressure. So I'm really opening a lot of the contacts, a lot more than I thought I'd get open. Because remember, you don't have to open them all today, unless you're not having the patient come back. There, see how we got that open right in there? And got a little bleeding around that tooth. And when you send the patient home, when they come back in a week or so, any of those contacts that were fused, they're opened. And then you do your final finishing and opening some more interproximal embrasures and get a lot of this flash off. Now this is a safe-sided finishing. It looks just like the Cerisaw, but it's a Cerisander. And then that allows you to get floss through much more easily. And these teeth will move around when the patient eats, masticates, whatever. And so any fused contacts will be open when they come back. But anyhow, we're not completely finished. We're going to do the adjusting the occlusion. And then when the patient comes back in a week, I always tell them we're not finished. And then you go back and you open the interproximal embrasures some more. Close. Grind around. Open. Hot plate. We call it a hot plate because if you warm it, it doesn't fog. It scares patients a little bit, and then when they don't get hurt, they're grateful. They know you're doing something important. Can you see the occlusion we have there? Now, many times, if you have excess Ultrabond, it'll register as an occlusal prematurity, and that's how you can find it. And we can open this interproximal embrasure. But usually I like to have the patient in the chair for not more than an hour, and the results are so dramatic. I'm going to open these embrasures just a little bit since we're getting a view from this side, that when they come back and you do more, and they go home. Sometimes they go home and they're looking for what's wrong and they're not sure and they see their friends. And I try to tell patients go home and forget about it if you can for a week. and they get used to them a lot quicker. Now, one of the questions nobody asks is, do patients ever complain about the thickness? And so I want to tell you how to get rid of that thick feeling. I had a lady that came up here from Los Angeles. It's about almost 200 miles from here. And her husband was a physician on the staff at UCLA. And so he came up and kept her company while I was putting her lumineers on. So we did her top teeth then. It used to take me a lot longer to do these. And she said, is there any place in town that has good margaritas? So we said, yeah. You know, we came out here to the airport. It was 6-7 miles from my office, and Mexican restaurant. Let's open that contact so I make sure these things will fit. So on the way out, she said, you know, and I had just done her uppers, and she said, these feel thick. And I said, yeah, in 2-3 months it'll go away. And usually it's after a week or so that they get pretty much used to them. So she's having her margarita. It's a good idea not to drink and fly, and a good idea not to drink and do dentistry. So I was having a diet cola. So anyhow, after she got finished with her margaritas, we're sitting there, she says, you know, these don't feel thick anymore. So you can tell patients that if they want to go out and have a margarita, the thickness will disappear rather rapidly. Now when you just do 6 and you stop here, you get this vestibule back here of shadow, and makes them look like they're missing teeth. So we're going to put these 2 on this side and let you see how we do that. It's pretty much the same thing, but first I want to try them on. And I got a little old composite on this Pontic, so that one's kind of dicey. I want you to know I'm really having second thoughts about putting that on that bicuspid, because so far everything's gone pretty good. But look how nice that looks all of a sudden. Also, I want to call to your attention. Notice the shade isn't the same as this shade because it doesn't have the resin under it. And when you don't have a continuous, okay, this little sucker here is going to be the challenge. Oh,
It fits beautiful.
it fits. Can you see that?
Yeah.
And then if you look at, the shade isn't the same as it's going to be, is it? I want to roughen the surface of the composite. So it's a fresh surface. And we're going to put some resin on there. Dissolve the surface of this composite. What I like to do when I'm doing porcelain over PFMs, and both of you and Lou know how to do that, but I use magnification and a very small round diamond, and I gently remove the metal so we have space. And this is what you use to soften the surface of old resin, any place, even in natural teeth. Okay? This is enamel, so we'll put a little etching agent on there, and a brush. Now what's so incredible about this is it makes such a difference to your patients. Putting on 10-year AB, everybody. So I've dissolved the surface of the composite. Now we put the 10-year AB on. We're not going to do a try-in here because we already did one, and we don't want to do it anymore. But look, you know, I mean, if you look at this looks like quite a mess, doesn't it really? And so you look at all your patients that you go to cocktail parties, and you just go up and slap them on the shoulder and say, you know, I could make those bridges look like new and never hurt you for a minute and never have to give you a shot. And half of them would not care for you, and half of them would come to your office in a minute. But this is such a wonderful thing for humanity. And the reason I say that is that if you think about what we're going to be able to do as a matter of routine, just look at that get transformed right now. And the color is so nice. Okay, and now this little phonic thing here. And the thing, you want to be real gentle with this because it doesn't take much to displace these and get a void. And so a lot of guys like to see how much finishing they can do before they polymerize the resin. And that's just setting yourself up for potential error. All right, so now we're going to do the 1 second tack. Close your eyes. And the 1 second tack. Close your eyes. Okay. Now we'll brush it a little bit more. I like to use this brush with a little crook in the handle. And Ian uses those little plastic tips with little round sponges on it. I want to take off some more here. Resin. And the other thing the resin does is also, you don't want to use a dry brush. It seals the margins. If there is any voids in there, it tends to flow into them like a sealant does on occlusal restorations. Now we'll take the 5 second here. Close your eyes. See, one of the reasons I don't like the slow curing lights is that if you take 20 seconds per tooth or 30 seconds per tooth, you might displace something. Now we'll go in with the American football shaped diamond. Well, I already got the little interproximal diamond in here, so we'll just open up these embrasures a little bit. Are you able to see that all right? And just trimming away the excess at the gingiva. Lumineers over porcelain is you don't want to do any opening of the contacts on the placement visit. Because if you put too much pressure on there, too much force, they'll pop off. It takes about 24 hours to achieve the maximum bond. Tooth has changed its appearance, and we just did it in a matter of a few minutes. Just gently open and close. Okay. And one of the things when you're doing porcelain on porcelain, I realize this isn't porcelain on porcelain, but you want to be sure that you don't have any occlusal prematurities in there, because if you do, that can pop the porcelain laminate off pretty easy. Now, probably the part that may bother you the most is looking at all the things we're using. And if you think about it as going on a trip, and you just go through the first mile and the second mile, and it kind of unfolds. And we didn't try to do it all at once. But look how that has improved the appearance of that. Yeah, now let's go over here. I'm really going to go. This is like Texas Hold'em. Let's go for all in. Okay. Well, now I have some composite on the adjacent tooth, so I have to open that up. And if I was doing 2 at a time, I'd have to open it up this way all the time. So now I'm taking this off. Now what I'd like to do is just try those 2 on, just to make sure I get them put in right, because it's a good thing I tried this, because now see I got a little heavy contact on that cuspid. See, now these look better. The only reason we're doing these is to bring them out to match the cuspid. We're adding some prominence to the teeth, and I just want to have it get seated. Something else you have to remember, you don't have to seat these all the way, you know. If ever you're putting a luminaire on, these are all set. So we don't have to do any try-in or anything. But you don't have to seat them all the way. You can put them almost down and then cure them with the light and bring them out. Little etch and seal because these are both enamel. And I always like to just squeeze a little out right on top of the tooth. There we go. And we're applying tenure AB now. And I'll just apply several coats of this. There it goes. It's just like a puzzle. So now we'll wipe off the excess. Now we're going to use that 2mm tip for 1 second. Close your eyes. And 2mm tip for 1 second. The Sapphire Light is really critical. One of the other things I'd like to point out is we have Saran wrap wrapped around the tip, and that keeps the composite from obscuring the fiber optic tip, and it's sanitary, and it really is a nice thing to do. Now remember, we've taken the 2mm tip and we've tacked the two bicuspids in place, but we didn't get to the lingual side. Now you see we can wipe this excess off the lingual side and not have to be so concerned about displacing the veneer and get a lot of it out of the way before we do the final tacking. Close your eyes. Got to really protect your eyes with this, and I just think the best protection is to close your eyes. And we do in 5 seconds with the... Okay? So you go back as far back as the patient wants. The way I like to do it is, it used to be we'd really grind the heck out of teeth and do 1 tooth at a time or 2 teeth. And here we've just done 10 teeth. I don't know how long we've been here, about not quite 2 hours, and probably I've been talking for 45 minutes. Every time I do this, I have a thrill of accomplishment that we were able to do. And poor old Hesse Ray, he didn't even have a drill. Oh, Shure 349 here. Now let's have the football-shaped diamond. We'll check the occlusion. Now I'm blending the porcelain and the Ultrabond and the tooth all together. In this case, I have direct vision. Couple little tips. See this lower cuspid right here with that blue mark on it? My fingernail's pointing to it. I use this right here. See that? That knocks off the distals of more maxillary lateral edges than anything I know. So you really want to check your occlusion. Close. Gently grind your teeth around. And then the mirror, please, hot plate. Okay. And can you see the marks on there? You want to be sure you don't have any marks on the porcelain. Otherwise you're liable to knock it out. And there may be give me a 349, not sure if this is a little extra composite on the tooth. You don't have to worry about what you don't take off. And you can do a little there. You see that? Did you see that just get moved? I just flicked off that high spot. And that was Ultrabond on there. And what you don't flick off, they'll flick off. And another thing we like to do is take the porcelain polishing paste, and there's a little extra in here. And we just go around. Can you see this as I'm going around in the mirror? Okay. And I'm looking for flash. I used to try to get it all. See how some of it's coming loose right there? I used to try to get it all off on the placement visit, and I would work forever doing that. And the patient would come back, and I'd still find some that I missed. So I stopped trying to do all of it. I just tell them I'm not finished. And a lot of the areas you'll feel things flicking off. And they brush their teeth, and they eat and sleep and all that kind of stuff. And a lot of this just disappears. And if you have a couple of margaritas, you won't care. So, here we did 10 of them, and the key to this is get your staff to look at these DVDs for 2 or 3 times without you there. Let them do it on their lunch hour after lunch, or have them stay later and pay them. But be sure they've watched it at least 3 times and do a couple of trial setups. And we're using that same porcelain polishing paste I was telling you about we like to use before we start. And we'll just go around and put this on all the teeth. And just polish a little bit on the linguals, because usually when I had mine put in, I remember it took me 2-3 days before they felt normal again. That's what she looked like before she started. Now we'll take a look at her teeth. And we'll turn sideways. And we'll go over this way. And go back to the second bite. And we're not finished. There we go.